So I was born in Oakdale, Louisiana, which is central Louisiana. I was raised in a lot of different places. My dad was in the Army, so I'm an Army brat. But about the time I was 15, we moved back to Louisiana, where my family was all from, and I graduated from Plainview High School. I went to college at LSUA for, I think, 2 semesters, and then transferred to Monroe. It was Northeast Louisiana University at the time. Names have changed since then, but I was there for a semester and a half. Then I quit school, and I thought I wanted to be in the workforce. Did a lot of different things. Worked at Boise Cascade Plywood Mill for about a year and a half, and decided that that's not what I wanted to do. So I went back to college at Northeast, and I majored in medical technology, and I graduated with a Bachelor of Science in medical technology. And I actually worked as a medical technologist from 1988, when I graduated college, till 1992, and that's when I entered medical school at LSU Medical Center in Shreveport. That was its name at that time. I still worked while I was in medical school in the lab there at LSU, which was a very nice help to help pay for medical school. I graduated medical school in 1996, and then I did my internship and residency again at LSU here in Shreveport, and finished there in 2000. My specialty is obstetrics and gynecology, and I'm a generalist, so I do the whole gamut of the specialty. OB or obstetrics, we treat high risk and low risk obstetrics. I have a very keen interest in high risk obstetrics, and I've had a lot of practice in that over the years. In gynecology, I do a lot of minimally invasive gynecology. Probably 80% of the hysterectomies I do are vaginal hysterectomies. That's the most minimally invasive surgery there is for a hysterectomy. There are no incisions on the abdomen. It just all is done vaginally. I like to do laparoscopy. I do laparoscopy for endometriosis and ovarian problems also. A big aspect of it, too, is office practice. So one of the reasons that I went into OB-GYN is because I liked internal medicine, but I liked surgery. And in my specialty, I can do both of them. I practice as a generalist, but there are areas that I focus on a little more, those being areas of minimally invasive gynecologic surgery. I've, over the years, had the opportunity to do a lot of surgery. I was trained very well in my residency, and I'm very fortunate for that. I like to do a lot of vaginal surgery, vaginal hysterectomies, and probably the most hysterectomies, the route that I do in the most is the vaginal route. Probably 80% of them are done that way. I also like laparoscopy because, again, it's a minimally invasive type surgery. But obstetrics is also, high-risk obstetrics is also one of the areas that I like to focus on, and I like to stay up to date with all the latest and the greatest and the changes, so I can provide the best care for those patients when those out-of-the-ordinary situations come up. I relate to my patients on a personal basis. It is an uncomfortable visit for them, so I try to make them feel comfortable. I try to come across as a regular person. After I've seen a patient a few times, I get to know about their family. They confide in you, things like this. And the patient comes first, in my opinion. If they want to come on a different day than they're scheduled, usually I make room for them to do that because I want them to feel like that they're my only patient. And I've always had that philosophy. My patients can call me anytime they want, and I'll respond to them and take care of them. One of the most important things in my practice is to always take care of my own patients. I've always delivered all my own patients' babies unless I was out of town. And it didn't matter if I was on call or not, I would just do that. And I think that's one of the most important aspects of being an obstetrician, is that relationship with the patient, because they're comfortable with you.